Bharat, blissful wisdom. In this video, let us learn how great our Rishis are, especially in the field of ancient medical science, the most advanced medicine. India, the land of amazing wisdom, was the birthplace of most advanced medical science, Ayurveda. Ayurveda was known and practiced in a much advanced state during Rig Vedic time. Remember, Rig Veda is considered as the most ancient literary work in the world, whose antiquity is in remote past that cannot be estimated with our calculations. In Rig Veda, there are some references of Ashwini Kumaras, the divine physicians who performed plastic surgery, transplanting of head, eye surgery, and then transplantation of teeth, transplantation of a leg to a woman warrior who lost her leg in the war, also about medicinal herbs. They know the technology of rejuvenation of body. Ayurveda was popular maybe around 10,000 years back as a systematic science away from, that is taken from Rig Veda and other Vedas. It was an advanced medical science, thus Ayurveda is the most ancient living medical science in the world. Samskrita word Ayurveda is coined by two terms. Ayur means life, Veda means knowledge or the science. Thus, Ayurveda is science of life. Actually, Ayu means that which moves forward. Its nature is continuation. Thus, it specifies age or life. Just like modern science, medical science, in Ayurveda also there were different branches of specialization. With regard to Ayurveda, I made 2-3 videos in very detail previously, please go through that. So, some Rishis were experts in some branches as given below. Nidani Madhava Shrestha Sutra Sthanet Vagbhatta Sharire Sushrutha Prokta Charakastu Chikitsake. Madhava is best for diagnosis, he says in his book Roga Viniscaya, that is knowledge of the disease. Vagbata is very prominent in aphorisms, sutras. Vagbata's Ashtanga Hridya is the text of choice even today. Sushrutha is supreme in anatomy and surgery. Charaka excel in general medicine. The popular scientists of ancient Indian medical science Ayurveda were Maharishis and Enlightened Masters. They did intense research in their respective fields and dedicated life to this science. Some of them were Sushrutha. Sushrutha was an ancient Indian surgeon and was considered by the modern world as the first physician who conducted plastic surgery and honor him as father of plastic surgery. He lived around 1000 BC. Some argue that it may be 900 BC also, in Varanasi on the banks of river Ganga. Sushrutha was specialized in Shalya Tantra, means the science of surgery. There were proofs of his expertise in advanced surgeries like rhinoplasty, reorganizing nose, removal of stones from urinary bladder, and he did several wonderful plastic surgeries. He performed skin grafting, transplanting pieces of skin from one part of the body to other part to restore the area lost due to accidents or during war. His book Sushrutha Samhita also gives the details of toxicology, pediatrics, pharmacology, etc. He says a surgeon should be a person with deeper knowledge, emotionally balanced with presence of mind, and his hands should be free from perspiration and shivering. The surgeon should use very fine, sharp, clean instruments, and that surgeon should have respect and concern towards patient. He was the author of Sushrutha Samhita, a complete work on medicine and surgery. This book considered as the oldest text on surgery in the world. In this book, he explained 300 surgical procedures for 1200 diseases. He discussed about wide range of herbs and 120 surgical instruments. Sushrutha Samhita was translated into Arabic language during 700 AD and into English in 1907. Maharshi Charaka Charaka was another rishi who contributed significantly to Ayurveda. It is believed that he lived around 400 to 300 BC in Kashmir area. Some say that he may belong to Jalandhar, now in Punjab. He wrote a great book called Charaka Samhita, a systematic and scientifically written treatise of medicine. He presented his work in Samskrita in the form of slokas with perfect meter and melody in brief to facilitate easy memorization by students. Maharishi Charaka was expert in diagnosis, treatment, and above all, he is the holistic physician who considers medicine for complete health, and much focus was on preventive measures than the treatment. He stressed the concept of three doshas, Vata, Pitta, Kapha, and says their imbalance creates troubles. He also focused much attention on food habits and moral behavior. His ethical code is the very foundation for healthy and contented lifestyle. Charaka Samhita is composed by him. It is an excellent book on Ayurveda which is popular as Charaka Samhita for all of us. He organized the entire work in 8 chapters called Ashtanga Sthanaha. They are Sutra, Nidana, Vimana, Sarira, Indriya, Chikitsa, Kalpa, Siddha. According to him, the 4 basic elements of medical practice are: first one is patient, second one is the doctor, the physician, then nurse and medication. Charaka Maharshi says Ayurveda is a gift from Paramatma, God, to the world. Another Maharishi, Vagbhatta. Vagbhatta was a great Ayurveda scholar and author of very popular Ayurveda books Ashtanga Sangraha and Ashtanga Hridya. He lived in the area of Sindhu around 600 to 650 AD. In Ayurveda, 3 great books, Charaka Samhita, Sushrutha Samhita, Ashtanga Sangraha, are popular as Brihat Trayi, means great trio, 3 great books. His grandfather and father were also Ayurvedic scholars. Vagbata learned Ayurveda from his father. Later, advanced course he did with Avalokita, a famous Gurudeva master in Ayurveda of those days. Those days, the Ayurveda literature was very tough. Disciples were finding it very difficult to understand. Thus, to correct that problem, he wrote books giving the essence of Ayurveda in simple and easy way so that students never misunderstand the science of life, Ayurveda. That is his compassion. Maharishi Madhavakara, Maharishi Madhava is the another great rishi who contributed tremendously to Ayurveda. He is a prominent person, lived around 700 AD, and his father was Indukara, was also a great scholar. He wrote a wonderful treatise on Ayurveda called Nidana Roga Viniscaya, which is popular as Madhava Nidana. Nowadays also it is very popular as Madhava Nidana. He suggested Nidana Panchaka, that is 5 steps in the treatment of patients. They are: first find the cause of disease, then preliminary symptoms, present symptoms, medicines, and the entire case study. He thinks these 5 are very important in treatment. In 849 AD, his book was translated into Arabic language. That's all in this video. May Rishis bless all of us with good health of body and mind.